folks. So welcome back for this afternoon. My name's Karen Grant, for those of you who don't know me or didn't hear me speak this morning. So this afternoon, we're going to try and do something about helping your students to prepare for medical school interviews. We had a bit of a chat about it during the question and answer, and I think some of that was quite interesting for me. I'm going to try and make this as interactive as possible, but I am aware that because I can't see the chat, that's going to be quite tricky until we get to the end. But what I suggest is I've got some slides where I've got any questions, and we might stop, and if you've got any questions, you can either put your hand up, although I can't see that either, or just unmute yourself and ask a question, because I want to try and make this a little bit interactive. It's obviously not what we were anticipating doing when we first set up this conference for. So the first thing that I wanted to think about, but I'm not sure how well this is going to work because I can't see the chat, was to get you to identify for you, what are your key concerns about preparing your students for interview? If you put your answers in the chat, I can't see it at the moment, but when we get to the very end and I stop sharing my slides, I'll be able to see the chat and we can maybe go over the questions then. So I think just so that if I haven't covered it in today's talk, we can go over those questions at the end. And as I said before, there'll be bits where I'm going to stop and ask you if you've got any questions. So in today's talk, I'm going to start off with kind of explaining a little bit about what the purpose of medical school interviews are. Then I'm going to cover a little bit about what the key skills, values and attributes are that we're looking for at interview. I'm going to remind you of the different interview styles. And again, I might allow you to kind of ask questions at that stage if you've got any kind of questions about it, because obviously you've never been through either of the styles of interview that are used commonly in medical school interviews. And then I'm going to talk about preparing for interview at the end. So if you think about what the interviews are for, generally what medical schools do is they use past and predicted academic achievements and perhaps the admissions test as a way of assessing academic suitability. And so the interview is doing something completely different. It's looking at non-academic kind of skills and attributes, I would say, in the whole. And for me, I think there's two main purposes, like if you were to try and summarize what they're for. One is to check that the applicant's actually suited to the particular medical degree programme. Obviously, no matter which medical school you go to, the qualification you get at the end is exactly the same. It entitles you to go into any branch of medicine. But all medical schools are quite different. They have different atmospheres, different values, different teaching ethoses. And it's important that your students are thinking about what would suit them and trying to apply to medical schools that would suit their various needs and aspirations. So that's one bit of what the interview is about. And in fact, John talked about that earlier, in that if you have applicants who come for interview and they can't tell you why they've applied to Edge Hill Medical School, then that doesn't look great. So one thing is, are you suited to studying here with us? And then the other part of the interview, and probably the larger part, is trying to determine whether the applicants, whether medicine is the right career for them. Do they have the right mix of skills, values and attributes that's going to allow them to succeed as a medical student and allow them to succeed as a doctor in the future? Okay, so that's, if you think about it, that's what we're trying to achieve at interview. So that means that actually preparing your students for interview starts before they've even applied to medical school. It starts right back when they're even thinking about it and you're trying to advise them at that stage. So first of all, is medicine the right choice for them? So you need to be encouraging them to find out what the right skills and attributes are and really reflecting on themselves. Do I have what it takes? You know, do I have these skills, values and attributes? Is this what I'm looking for out of my sort of life? And this is where work experience, which we'll talk about later, kind of figures into this. It's like the work experience should be a way of them going, I think I want to be a doctor because I think it's going to be like this. But they need to kind of see a bit of the reality of healthcare, and check that they're able to cope with interacting with vulnerable people who are not very well, might not be particularly nice to them, might be covered in sick or blood or pus or all sorts of like nasty things. So actually, there's a little bit of them exploring why do they want to be a doctor, finding out what skills they need, trying to reflect back on themselves to decide whether they've got those skills, values, and attitudes. That's the first thing. Is medicine right for them before they even start? You can't make that decision for them. You might have an opinion. All you can do is try to kind of encourage them to engage in that reflection and find out and make an informed choice about whether medicine's right for them. And then choosing a medical school. So you need to be encouraging them to think about how they learn, think about what might suit them in terms of structures of medical courses, and really applying to medical courses that are going to suit them. I think sometimes applicants become a bit more strategic, and I guess that's okay, in that they're thinking about where are they more likely to get in, you know, what selection process might play to their strengths. That's okay, as long as the course that they have chosen for those strategic reasons is still something that they would be happy with. Because A, the selection process is likely to assess whether they're suited to that way of learning, but B, if they're not suited to it, then they're not going to be all that happy here as a medical school. So it's a bit of a two-way process. So you need to kind of help them to explore the different types of medical degree courses. So obviously you had a talk this morning about those different degree types of delivering medical education and what might be the ways that you could explain them to your students to help them make that informed choice, and then encouraging them to make informed choices. And before they go for interview, at least making sure that they understand what the key elements are, what are the key unique selling points of the degree programme that they're going to be interviewed for, so that when they talk, they can talk and explain why they have chosen this particular medical school to apply to. So before they've even applied, you're preparing them for interview already. Where can they get information? So medical school websites will tell you a bit about the way the course is structured. Go to open days, speak to staff, speak to students. I think the really crucial thing for your students is talking to current medical students and getting that kind of unvarnished version of what it's like to study at a particular medical school. What do they like? What do they not like? And then allowing them to kind of think about what would suit them. So when a student says they really like this, would they really like that? So it's about getting information. And then in terms of those key skills, values, and attributes, there are a couple of sources of information that you can point them towards that will help them to understand what is required as a medical student and as a doctor, but also therefore what medical school interviews are going to be trying to assess. So one of them is the NHS core values. I'll talk a bit about that in a couple of slides' time. And the Medical Schools Council have created some guidance about the attributes that they think that. So the Medical Schools Council did a bit of work with all the medical schools and got us to kind of agree on a set of shared values and attributes that we're looking for. So one thing I wanted to do was to kind of get from you what you think those skills, values, and attributes might be. Now, I was going to get you to post it in the chat, but I think it's going to become a bit complicated because I won't be able to see that. So does anyone want to just unmute and tell us something that they think would be a key skill that they think we're searching for? Anyone brave enough to unmute and say something?
Communication.
Communicator. Oh.
I'm gonna write some of these down. So somebody said communication, definitely.
Empathy.
Good team player.
There.
Problem solver.
Displaying empathy.
Resilience.
I'm writing these down. I'm not ignoring you, I promise.
Academic potential. Resilience.
Got resilience already. So I've got communication, team player, empathy, resilience, problem solving, academic potential.
Leadership skills. Work under pressure.
Determination and can-do attitude.
Okay, determination. So are these things that you think we're looking for, or are these things you would look for from your doctor? It's just a question.
Both, probably.
If I was to say to you, what are you looking for from your doctor? Would you say anything in addition?
Compassionate.
Compassion, yeah. That you don't feel as though you're on a clock when you see somebody.
Okay. I don't know quite how to capture that. I absolutely know what you mean.
Relatable.
Professional.
Personable.
Somebody said professional.
Mm-hmm.
So it's interesting. I think everyone has a slightly different interpretation of what professional means, but everyone knows what non-professional, unprofessional looks like. As medical schools, we try really hard to kind of engage our students in what does professionalism mean. And it's quite interesting that as a concept that professionalism means a different thing to different people. I've got lots of things here, so thank you very much for that. I'm now going to go on to what the medical schools have said. So I went on to the Medical Schools Council guidance about core values and attributes. And this is the things that we have all agreed that we're looking for. So teamwork's on there, resilience is on there, problem solving is on there. I'm just trying to look. Is working under pressure on there? Manage risk and deal effectively with problems. Communication is on there. Empathy is on there. So you'll see that and maybe, do you know the person who said you're not on the clock? Ability to treat people with respect. Perhaps that's the kind of trying to treat you with respect, even although you have an agenda that you need to see this, deal with this person within the kind of confines of your clinic or your surgery. Is there anything on there that any of you are surprised about?
Insight into your own health.
Yeah. So that's part of professionalism in medicine, in that if you're unwell and you don't have insight into your own ill health, you may well deliver healthcare that's not appropriate, not at the appropriate standard, and you may have an impact on a patient's health because you haven't taken appropriate action. So actually being able to recognise when you're unwell and to kind of do something about it is something that students and doctors are expected to have. So they need to have that kind of insight into their own health. Any other comments or questions about some of these core values and attributes?
Why are some in bold and some aren't?
Oh, that's just to make it so that you could see them, because when I put them all in the same font, it was just a bit all over that's maybe just me. I like to have something for contrast.
Okay, thank
No
you.
significance in bold or italics. It's just really so that you could see one from the other. All right, so we'll move on. So if any of you want to find out what those core values and attributes is, there is guidance on the Medical Schools Council website page, which we have been all pushing today. And so you can find that guidance. It's got those things in there, and there's some guidance that's directed towards applicants, and then there's but it might also be of interest to you so that you can kind of see what it is that we're looking for. The other thing that might be useful to get your students to engage in is the NHS Constitution and the NHS core values. So if you just Google the NHS Constitution, it takes you to a government website with where the NHS Constitution is. And this little quote that I've given you is part of the opening sort of statement about the NHS Constitution, where it says, the NHS is founded on a common set of principles and values that bind together the communities and people it serves, the patients and the public and the staff who work in it. So one of the things that we do when we're selecting students to become medical students is we want to know that they understand what the core values are, because they're being asked, they're going to train within the NHS and most of them will work within the NHS. So we're asking them whether their values coincide with those core values that are sort of part of the principle of that common shared value system. And also they're going to have to buy into it, because that's what underpins everything the NHS does. So the core values have some headlines, and these are the headlines, and then there's some stuff underneath the headlines which tells you a bit more about what they mean by it. But again, this leads into what you were talking about when you talked about what you wanted out of your doctor: compassion, respect and dignity, not treating you like a sort of a conveyor belt. Improving lives is about sort of improving health overall rather than treating sick people. Working together for the benefit of patients, everyone counts. So that's all about equality and diversity and making sure that all patients are treated as equally as possible. Commitment to quality of care, so spotting when something's not right and doing something about it. So those are the core values, and I think I'm going to come back to the core values slightly later on, but I think as a framework for helping your students kind of reflect back on why they want to be a doctor, experiences they might have had, I think the core values are really quite useful. The core values from the MSc are more personal, whereas this is more about what's it like to work in healthcare, and might help them in that kind of reflection that we want them to do on their experiences to date. Any questions about what we've talked about so far, people? And remember, I can't see your chat, so if you've posted a question in the chat, I won't be able to see it at the moment. No? Okay, well, we'll move on and we will stop later on. So if you have any questions, there will be other slides like this where we'll just take a breather and you can ask any questions. So next I'm going to go give a quick scoot through the different types of medical interview. So for a long time, medical schools used a traditional panel interview where the applicant might have been interviewed by 3, 4, 5 people, might have been a mix of academics and clinicians generally. And there are still some traditional panel interviews used. There's a much smaller number of medical schools use traditional panel interviews. When I did a little bit of Google search myself, I found that Glasgow University uses it, Barts in the London use it, and Imperial still uses a traditional panel interview. That was the last time I checked anyway. And then there is the other flavour, which is much more prevalent these days, which is the multiple mini interviews, or MMIs. So St George's and Dundee were the first medical schools in the UK to introduce MMIs, Lancaster was next. And then after that, there's just been a cascade of people kind of introducing them. And I'm going to talk about the 2 different types. So traditional interviews, applicants are interviewed generally for a set time so that everybody gets the same opportunity to demonstrate their suitability by a panel of interviewers. The panel of interviewers, I think over the years has kind of expanded. So you would have academics, you would have NHS staff, clinicians, you might have a student on there, and you might have a lay representative, a member of the public on there. And that's just about recognising that there are more stakeholders in selecting the correct students onto a medical degree programme than just the academics and the clinicians. The interviews will be relatively structured. They're going to make sure that all applicants are asked the same sorts of questions and the same sorts of areas are explored. And then the interviewers will score the answers according to some defined criteria. Again, trying to take out the subjectivity and make the assessment at interview as objective as possible. So again, a little bit of Dr. Google. I went on and had a look at different medical schools that were using panel interviews and what they said on their websites about what might be asked at interview. So again, in terms of preparing your students for interview, if they're going to an interview at one of these medical schools, there's information on their web pages that's available, freely available, that tells you what kind of questions might be asked or what kind of areas are going to be explored at interview. So motivation and realistic approach to medicine as a career. I think that's really important. It's really important that they know why they want to be a doctor and they know they've got a really clear idea of what it will be like. They don't have some kind of naive rose-tinted spectacles version of working in healthcare. They kind of know the gnarly aspects of it as well. Demonstrate initiative, resilience and maturity. Evidence of working well in a team, both as a leader and as a team member. So again, all of these things are picking up the things that you said that you thought would be important. Communicate effectively in a wide range of situations. Deal with stressful situations and ability to multitask. And that's really getting to the crux of the matter. When they become a junior doctor, they're going to have to be able to juggle and keep on top of lots of different things. And being able to cope with stressful situations, that's resilience in another guise, isn't it? And then evidence of commitment to the values of the NHS Constitution. So they need to be able to know what those values are and be able to explain what they mean to them and how they've seen it embodied when they've perhaps had work or voluntary experience. So that's traditional panel interview. Multiple mini interviews, sometimes called speed dating for medical admissions. They might, like the top diagram, they might be going into multiple different rooms, interacting with multiple different interviewers. They might have all the interactions with an interviewer might all be the same length, or in this case, the first one slightly longer and all the rest are 5 minutes. Or all of the interactions with an interviewer might all be within one big room, so that the room is divided into different areas and they will move around and talk to all the interviewers for a set amount of time. So we tend to call each interaction between an applicant and an interviewer a station. And this comes from, for us, this doesn't look like speed dating. This looks like a clinical exam. The OSCEs, the objective clinical structured examinations, how the students are going to be assessed when they come to medical school in terms of their communication and clinical skills. An MMI is really an OSCE for admissions into medical school. And so that's where the terminology station comes from. You go to a station, you perform a particular task, you answer certain questions about a certain attribute that's being tested, and then you move on to the next station and you are asked a different set of questions or asked to complete a different task. So an MMI is really just a format. It's just a format. It means that there's going to be multiple short interactions rather than one long interaction. But apart from that, it's going to vary a lot. The sorts of questions that are asked in the MMI might vary. The number of stations will vary. The time spent at each station will vary. So all that really the MMIs are doing is giving your students multiple opportunities to demonstrate that they're suited to studying medicine at that particular medical school. So it's testing lots of different skills and attributes, but actually each interaction with an interviewer is completely independent of every other interaction. So in contrast to a traditional interview, where they're going to ask you questions that are testing different skills and attributes, but they're all together. And so what we can't tell is whether if one of your students answered one question brilliantly, but another question really poorly, whether that would colour the overall impression of them. Whereas here, each task or attribute is being assessed independently of the others. So they might have break stations within their MMIs. So again, on both of these diagrams, we've got a break station. There might be something called a preparatory station. So we do that at Lancaster, where we generally have 3 stations where there's a 5-minute prep station. So they will be given something to read. Sometimes it's a video clip to watch. They have the chance to think about what they're going to, what their response is to this video clip or this piece of writing, get some time to take some notes, gather their thoughts, prepare their answer, and then move on and discuss it with an interviewer on a subsequent station. So some have prep stations, some have within the time, so say there's 10 minutes in each station, but the first 3 minutes are prep for the station, and then 7 minutes interview. All sorts of different ways of doing it, but the medical school should give your students some information in advance to help them understand the format and what they're going to be doing. Each skill or attribute is being assessed at the station and will be assessed against clearly defined criteria. So again, trying to remove the subjectivity of interacting with an interviewer, is trying to look at just this skill, just tell me how well did they answer these questions about this attribute, or how well did they demonstrate this skill in this station. It sometimes sounds quite challenging. Applicants are going to have to, instead of just having one interview, they're having to go through this process multiple times. But for me, there is an advantage to applicants in the multiple mini interview format, in that because each interaction is independent, it means if they do have a station where they don't do as well, so maybe they just don't understand the question, they feel that they don't hit it off with the interviewer, it's not the end of the world, because they've got all the other stations where they can, if they do well, they'll probably still be made an offer. So it's about helping them to understand that and seeing this as multiple opportunities to impress. And if one doesn't go very well, to be able to kind of draw a line under it and move on to the next station and just try and put it behind them. So some of the stations will be interview based, so it will just be a very short interview interaction. And it might be something like, tell me about your work experience, except it won't be framed like that. We'll get back to that at the end. Some might be task based. So for example, role play is quite common. Look as a way of testing communication skills. You might have an actor pretending to be somebody and the student's supposed to talk to them and their communication skills are being assessed. Some MMIs might assess their group skills. We do that at Lancaster because our curriculum is problem-based learning delivered. We really want students to be able to work well in small groups. And so we do a group skills task within our MMI. I've talked before about maybe being asked to read a passage or watch a video clip and then comment on it. So that's the prep stations or the prep within a station. And as I said before, I think the main thing that differentiates traditional from an MMI is that you have multiple independent opportunities to impress rather than one, which might assess a similar range of skills. We talked this morning about the challenges of COVID, and obviously the ongoing COVID pandemic means that it's quite likely that some or maybe all of the interviews will be online next year. We can't tell at the moment. So this year, a variety of platforms was used. Some people used, we used Microsoft Teams, worked pretty well. Some people used Zoom, and there was other platforms that were used by different places. There was a couple of medical schools that asked applicants to record their responses to interview questions, and then they were assessed asynchronously. So they were asked to record themselves responding to the questions, and then that was uploaded, and then somebody assessed them later on. And that's certainly something that we did for our formative OSCEs this year. That the students were asked to kind of perform something to camera, and then they were assessed as and when people had the time to do that. So if there is virtual online interviews next year, it's really important that candidates have suitable space, suitable device, and adequate broadband or internet connection. And so if you have people who don't have that, one of the things that I think would be really, and I'm sure you've all been doing this, but it's kind of like one of the ways in which you can support your students is by providing them with a nice, quiet, empty, clear space for their interview, providing them with appropriate equipment, providing them with somewhere which has got good internet connectivity. Again, MSc put together some guidance for online interviews, and so if that continues into the next submission cycle, that might be something for you to go and refer to check that you can support your students appropriately. Do we have any questions about any of that?
Can I just ask, in the MMIs, the cubicles, is that physically in a room that they attend, or is that online at the moment?
So normally it would be physically in a room. I don't know what everybody did, but this year we did it all online. So
Okay.
each interviewer, each station was a Teams meeting, and
Okay.
the applicants were sent to each Teams meeting. So it was like, go to this team meeting for 5 minutes to do, and then go to the next team meeting to do the next station. So that's how we did it. I'm pretty sure that every medical school that did remote MMIs probably did it slightly differently, but that's how we did it.
Okay, thank you.
But generally, we generally have a big hall and then have tables spread about, and then we put up some physical dividers to kind of create little like cubicles for them to go from one to the other. Any other questions about the interviews at all?
Hi, Karen. I've just got a quick question. I was just wondering, for those students who don't have English as their first language, or they have learning difficulties, is there any provision to be able to accommodate those students? And a second, and another question.
Shall I answer that one first, and then
Yeah,
you can
of
ask me your
course.
second question?
Yeah.
So people who, if it's not their first language, I'm not sure what we would be able to do in terms of that. Because they're going to come to medical school, and especially here, they're going to be in PBL, they're going to have to be able to communicate clearly in PBL about what they've learned. They're going to have to work in small groups with everybody. In terms of if they have specific learning difficulties in terms of reading speed, for instance.
Yeah.
So one of the things we do, if they can provide evidence that they have a specific learning difficulty and they have a recommendation for, say, 25% extra time in exams, then what we can do is give them 25% extra time in the stations where there's a lot of reading. So most of the stations, if there is any reading, it's like sentence. But the prep stations are the ones where there tends to be more reading and they've got to write. And so we would give them, if they're entitled to 25% extra time, they would get 25% extra time on those stations. Does that help?
Yeah, it does. Yeah, that really helps. Thank you.
And to your other question?
Yeah, it was just really how, in terms of once you've got to the interview stage, is the slate wiped clean then? So in terms of like your personal statement, your GCSEs, your predicted grades, and is the interview like the overriding thing that you would base an offer on? And I was just wondering if that's the case for students who maybe have widening participation criteria or a contextual offer. Does the threshold to pass the interview, is that lowered, or is that still the same?
Okay, it's quite a lot to unpack in there.
Sorry.
It's all right. So I can only talk about Lancaster. So for Lancaster, your academic grades and your BMAT, that gets you to interview, and then your offer is made entirely on your performance at MMI. Well, generally it's made on your performance at MMI. So that would generally be what we would do. I don't know if that's the same at everywhere else. I can't talk about other people's selection processes. I don't know whether, I have a suspicion that at some other places, you kind of get a score for what happens before you get to interview, and you get a score for your interview, and they kind of come with a combined score and make their offer decisions based on that.
Yeah.
So I don't think it's one answer for every medical school, unfortunately. But at Lancaster, generally, we are sort of just making offers on the basis of your performance at MMI. The only place where that might not be 100% true is when you get to the boundary between, right, we're going to make a cut off here. There sometimes you'll see an applicant and you'll go, well, they've done okay at interview. You know, they're just on the right side of where we're going to draw the cut off. But when you go back to look at their academic performance, you're kind of like, oh, actually, their GCSE sciences grades are quite low and their BMAT's quite low as well. Both of those are an indication that they're not as likely to get A's at A level in biology and chemistry. So if that's what they're taking, we might make a different decision round about those boundaries. That generally, people are made their offers based on their MMI score. Then you asked about WP applicants. And so in the past, what we have done is we generally have an offer list and then a reserve list. So people who we generally invite a bunch of folk to interview and we make offers to the top 50%. So you've got 1 in 2 chance of being made an offer if you come for an interview at Lancaster generally. But then the people underneath that, we would tend to put in a reserve list. And that would mean that if at A-level results day we haven't filled all our places, we would go back to that reserve list, see if any of them have achieved the grades and backfill using them. Of course, that's no guarantee you'll get on. But so in the past, we have had a look at the reserve list and might have picked somebody who was on the reserve list but was WP and kind of made a different decision for them. So it's kind of giving them that additional consideration. What I will say this year is we didn't do that because we had so many of our WP interview applicants doing really well at interviewing, already getting offers. We didn't really feel it was necessary because we were already making nearly 50% of our offers that were contextual offers this year. So we haven't done it this year, but that's the kind of approach that we have taken in the past.
That's really helpful. Thank you.
Does anyone else have any questions? No.
Sorry, Karen. Can I just ask? The main differences between the BMAT and the UCAT, as it's now called, one is obviously biomedical and one's the clinical aptitude. How would students know which one that the university is going to favour? Would that just be obvious in their application?
So it's on UCAS. If you look up UCAS and look at the entry requirements, it says which admissions test is required. It's on our websites. So it's published which ones that each medical school uses. And again, to go back to the Medical Schools Council, they have on their webpage, they have a comparison of all the medical schools, and it basically takes you down through what admissions tests do they want, what's the style of interview, what are the required subjects at A level, blah, 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 blah. So it's all together in one place where, you know, your students could kind of like do a bit of a compare and contrast.
Right. So, sorry, am I right in thinking then, if they're not so, or they don't believe they're very science, maths based, they're better finding an institution that does the UCAT, or is that wrong?
I don't know that that's particularly true. So what I would advise, if that's what they think, is that they need to probably go on to both of the UCAT and BMAT make practice questions available.
Yeah,
so they need to go on and have a go at them. I think the thing with BMAT questions, and again, I can't talk about UCAT because we use BMAT at Lancaster. So BMAT is designed to be really testing. So it's not designed to be easy. So they almost have to kind of like have a different mindset when they go in and do those questions about what proportion do they need to get right to have a chance of getting in. And again, we publish our kind of like BMAT scores kind of ranges on our webpage for our admission statistics to kind of give people an idea of what kind of score are you looking for. And I think they're often quite surprised at what scores are going to get them into medical school. It's because they're so used to always having to get the A's and the A stars and everything to have a chance at medical school. They think that they need to be getting 6s and 7s, you know, the high scores on BMAT. And actually, they don't. It's the bottom line.
Oh, thank you very much for that. Thank you.
BMAT's a whole other, we can do a myth busting for BMAT another time.
Thank you very much.
Okay, so preparing for interview. Again, so we talked about what are medical schools looking for, and then what is being assessed. So they're going to be assessing those skills, values, and attributes that we talked about at the very beginning. They're going to be assessing communication skills. That is basically being assessed every single interaction. Going to be looking at their understanding of their career choice, going to be looking at their motivation to be a doctor, because you want people who want to be a doctor for good reasons. So, and this kind of goes back to, do you know the debate we were having at lunchtime with the students saying that they were using the Medic portal, they wanted practice questions, they wanted somebody to tell them what the answers are. And then the medical school perspective was that doesn't actually go down terribly well at interview, actually. So although the students perceive that that's what really helped them, our experiences is when you come across a pre-prepared answer, it doesn't come across well. So I think for you, you want to try and help them develop the skills that we're looking for, and you want to help them present themselves with confidence. That's the two things I think that you can have an opportunity to kind of influence. Whereas I don't think anticipating what the questions are, giving them standardized answers is a good approach, because what we see at interview is that doesn't tend to, it only takes them so far. And the minute we ask a follow-up question, they don't have anything underneath it to back up what their answers are. We'll maybe cover that a bit later as well. So you want to develop their communication skills. You want to be able to develop their reflection skills, being able to reflect back on things, and I'll talk a bit more on that, and build up confidence so that they're presenting themselves well at interview. So how can you encourage reflection? So the Royal College of General Practitioners has got a kind of resource that's on their webpage, which is a reflective diary, and it's designed for potential medical applicants to help them prepare. So you could encourage them to download that, have a look at that. That helps them to understand what reflection is. But it's basically asking them to look back on their work, voluntary and personal experiences. What's their understanding of what being a doctor is going to be like? What's that based on? What have they seen? What have they observed? And then also their motivation to become a doctor. It's about reflecting on themselves, reflecting on their own skills, values, and attributes, and how that matches to their chosen career. So, in terms of career choice, what have they observed? What have they learned from observing others? So it doesn't have to have been work experience, but work experience, volunteering experience, even maybe just observing how doctors have interacted with them themselves. What skills have they as applicants developed through all sorts of different ways? That might be through paid work, it might be through work experience, it might be through volunteering, or it could be through their extracurricular activities. But they should be thinking about, what skills do medical schools want to see? Do I have them? How can I demonstrate I've got them by talking about things that I have done in the past? Why are these skills important? So not just because the Medical Schools Council has given me a piece of paper that says that these skills are important, but how have I observed those skills being used in action when I've interacted with doctors, when I've been in work experience, when I've been in a healthcare environment and maybe seen how nurses or physios interact with patients. And as I said before, kind of using the NHS core values as a framework for those reflections can be really useful in terms of them picking out things that they might have observed that are demonstrating when a doctor's sort of demonstrated compassion, or when it's obvious that everyone counts in the NHS because of the way that somebody in healthcare has acted. In terms of the motivation bit, what attracts them to a career in medicine? Why medicine and not another healthcare career? That's the sort of thing that we might want to explore. How have their experiences, so again, that might be work experience, it might be voluntary experience, it might be personal experience of being ill or interacting with a doctor. How have they cemented that ambition to become a doctor? So again, it's about reflecting back on, I observed this and that made me even more determined to being a doctor. So that's the kind of reflective stuff. And a lot of the time I'm talking here about reflecting back on work and voluntary experience, and that is a lot of the time what we're asking them to do. But we know that COVID has made it very difficult, if not impossible, for them to get work experience this year. So again, Medical Schools Council have got some guidance about what to do instead. We feel as if we're plugging the Medical Schools Council today. The Royal College of GPs has got a set of doctor-patient interactions that are captured on video called Observe GP. which if they were to watch and then use that reflective diary to kind of reflect what they'd observed, what they learned from that, that would be something they could do instead. Brighton Sussex Medical School have a whole virtual work experience package that students can sign up for. And again, that's kind of helping them to talk through and develop some of the understanding that we normally look for. So what else can they do? There's still the ability to do voluntary roles. There's still kind of befriending of isolated people, can work in a food bank, become an NHS volunteer on wards, handing out cups of tea. This is one of our current students who does just that. He's like a kind of clinical support worker. But there's also all sorts of other things they can do. Watch and read the news. One of the students talked about that before. I think that's been really important over the past year, kind of keeping up with what's being said about COVID and what do they think about the restrictions, people's objectives to restrictions. Lots of blogs out there where doctors have been like reflecting on their experiences of working during the pandemic. Those are really quite powerful. There's documentaries, ambulance 24 hours in A&E, the hospital. Again, don't just watch them as entertainment, but watch them and reflect what you've learned from watching them. There's a bunch of podcasts which are available. There's one called Inside Health, which talks about kind of current issues in terms of health, and that might be new drugs that are being sort of brought out or responses to the pandemic. Inside the Ethics Committee is a good one because it's looking at the kind of non-science side of medicine. And then this is one of my favourite podcasts. I am a bit nerdy, which is called This Podcast Will Kill You. And This Podcast Will Kill You starts talking about infectious disease, but it covers, and here's somebody else talking. Is everyone muted? Oh, perfect. So This Podcast Will Kill You, it kind of it starts off talking about infectious disease, but it covers the history of medicine for that disease, covers ethics, it covers lots of things which are really kind of wider than just the science. So they can engage with any of these things. And one thing that would really help them for an interview is to set up a group. If you've got a group of students in your sixth form college or school that are thinking about applying to medicine or other healthcare professions, set up a discussion group, get them to take it in turns to select something to watch or listen to or read, and then come back and talk about it. That will improve their communication skills. It will help them to explore alternative opinions when people have different opinions from them. And it will develop a wider understanding of this career that they have chosen. And again, get them to reflect back on what have they learned about that is relevant to the role of a doctor, skills a doctor might need, or those NHS core values again. Any questions about that? I'm aware we're rapidly running out of time. No burning questions about any of that. Okay. So next I'm going to talk a little bit about mock interviews. I think I probably come down in the same spot of where Fiona Watson comes down, is that I'm not convinced of mock interviews in their value. But I think there's something to be said for improving your students' confidence in just being able to talk to somebody and formulate a question, formulate an answer to a question that they didn't know was coming, and perhaps responding to challenge when that person says, well, why have you given that answer? You know, why is that what you're going to say? It does give you the opportunity to kind of explore with them the different type of questions they might come across when they go to interview. So the two common ones are behavioural. So tell me about a time when you've behaved in a particular way. And so that if you're trying to think about what the examples might be for those behaviours, it's what are those key skills and attributes? When might they have developed them? Can they think of examples off the top of their head? Situational is more, if you were in this situation, how would you behave? And again, we'll be exploring those key skills and attributes that medical schools are looking for. So you want them to be able to develop the ability to formulate answers quickly. You want them to be able to reflect on past experiences to formulate those answers, to kind of inform them, to practice articulating what they think and why, and being able to explain their rationale for their answer and defend it. If somebody comes back with a bit of devil's advocate, well, why have you said that? You know, and so in our MMI, there's always something about ethics, and ethics is never black and white. So there's always two sides to the argument. And the minute an applicant says that they come down on one side of the argument, the interviewer is going to come back with the alternative. Why is this not important? And I think for you need to kind of like tell your students, that doesn't mean that they've got the wrong answer. It's about, okay, you just have to explain and defend that position. We're not looking for you to change your answer. So there is some benefit of getting your students used to talking to strangers, used to having to listen to a question and formulate an answer, and getting used to responding when somebody kind of challenges their answers. If you're doing mock MMIs, so Rachel Chow talked about the fact that there's some guidance about running those. I think it's quite important to do it under timed conditions, because in an MMI they have a really short period of time. No matter which medical school it is, they're going to have 5 or 7 or 10 minutes to get their point across. So they need to kind of be able to think, formulate an answer, and be succinct in how they give that answer. And I would really thoroughly discourage pre-prepared answers, because I'll tell you for why. There's 2 reasons. So the first is that pre-prepared answers has a tendency to make applicants not really listen to the question. They kind of half listen, go, that's close enough to what I've pre-prepared, and then try to give their spiel. So sometimes that means they're not actually answering the question they've been asked. And the second thing, which is what John was talking about at lunchtime, is if they give their pre-prepared answer and then there's a follow-up question that asks them something about that and they haven't thought about it, there'll be nothing underneath that. They've just said something because a medic portal said this is what you should say in response to these questions. And really, every interview is going to be different. There are going to be different questions asked everywhere else. So if they get too used to thinking they're going to get a very specific question, A, they might not answer the question they're asked, but B, they're less able to cope when it's something they weren't expecting. So you need to kind of prepare them to expect the unexpected. There's going to be things that you can think about and prepare and think about in advance, but making the answer in advance is presupposing what you're going to be asked. And I think it's quite rare that medical schools actually ask the question in the way that students think the question is going to be asked. So if you're putting on a mock interview, remember to get your mock interviewers to include an element of devil's advocate whenever they're interacting with them. And try to give the students some feedback on not just the content, what they said, but also the way they present themselves. So are they making eye contact? Are they sitting with a nice open body? Are they giving good non-verbal communication as well as verbal? So I've got some top tips for you to pass on. One is listen carefully to the question. You'd be amazed how often applicants just don't answer the question they've been asked. Take some time to think before you answer. That's absolutely fine. They don't have to answer straight off the bat. In fact, I'm a bit suspicious if they do that. I would prefer for them to kind of look as if they're actually thinking and formulating an answer. Sit with an open posture. Try to be as relaxed as possible. So that's where you can help them to present themselves with more confidence, make eye contact, be prepared to debate their opinions. And I always think being enthusiastic goes a long way. So if they are really enthusiastic about being a doctor, allow that to shine when they come for interview. And then the remaining calm is about that kind of resilience. Don't go to pieces. You know, being a medical student, you're going to have to talk to lots of strangers on the wards all the time. You're going to have to interact with scary consultants. So try to remain calm. For an MMI, there is some additional kind of tips, I think. So they're often sent lots of information in advance, and it's maybe quite overwhelming, but it's about making sure that they have read that information, that when they have maybe an applicant briefing in advance, they listen to the information they're given. Because the better informed they are about what's going to happen, the more they can just relax into kind of presenting themselves well, and the less kind of stress they're going to get about what am I doing, where am I supposed to be. So that's for MMIs. And then The things to avoid: preparing students for specific questions, rehearsing pre-prepared answers, littering your answers with buzzwords when you don't have anything underneath it. So don't tell me about teamwork if you can't tell me why teamwork's important. And this is one of the things that I think is really tricky, is that we want you to prepare them so they can present themselves in the best possible light. But I don't want a false impression. I want to know what they are really like themselves, not kind of them presenting us with what they think we want to see.